My name's Bob Martino. I'm a dentist. I graduated in 1990 from WU Dental School. And the great thing about me is instantly, right out of dental school, I joined Fortune. And so the great thing is I didn't have to learn it the wrong way. I learned it the Fortune way, which helped me throughout all my life. And, I have multiple practices, but I also have multiple businesses. And Fortune has been part of that the whole way, from my airplane maintenance company to our mouthwash Oracare. So Fortune has helped me throughout the years in just being there for me. It's great to have an organization uh, that already has the answers to some of the problems that I don't even know about, and they're always there. And if they don't know the answer, they know someone that does, and it's just been great having that. I don't know, safety net, I want to call it, and it's been very valuable throughout my whole career. How I work with Fortune nowadays is Fortune has been there for me for 30 years, and so now it's my turn to try to give back to Fortune. And so what I can do is, I'll get on a phone with a client and explain how Fortune has worked with me. I can, talk to them, and I've been there. I've been where they are. And so I can say, trust the system. Look, the system has worked for me. So it's really, I don't know, rewarding for me that I can give back to a company like Fortune that has given me so much. Well, I think clinical coaching is very important in your success, because we can have the best business, but we have to make sure the clinical part. I always say dentistry is like a white collar and a blue collar. The white collar is the business. The blue collar is we have to do stuff on patients. We actually have to physically uh, heal them. And I think there's a way to do that. And clinical coaching is very important, because, sometimes the only thing that we've learned is from dental school, which is sometimes 20, 30 years behind what the real world is. Well, I think the biggest missed opportunities clinically is hygiene. I think as doctors, we're drill and fill guys, and we worry about the big cases. But I think hygiene, the cleanings, the sealants, the preventative stuff, the fluorides, I think that's very profitable. And I also think that, it's what's best for the patient, but it's great for the practice, because it helps hygiene be profitable, but it also helps the operative be profitable. So I always start with hygiene first. All right. So why is Oracare different? Why did we start it? Well, we hated this product called chlorhexidine, and if anything, our goal is to put chlorhexidine out of business. It's a terrible product, and lots of dentists use it. And the only reason why they use it is because they used it in dental school. So we founded Oracare about 15 years ago, and it does not stain. It kills bacteria, viruses, and fungi. All the bad things about chlorhexidine, we engineered Oracare to fix all those things. So Oracare is now used by thousands of offices, and it just works. And it's not something that you can use for 2 weeks. It's something that you can use for a lifetime. I think the reason why Oracare is a game changer is that it was invented by dentists, and we understand how the dental practice works. Number one, for a hygienist and for a dental team to get behind a product, it has to raise the standard of care. And that's what it does. It's great for the patient. It makes the hygienist's job easier. But also, because we're dentists, we wanted to make sure that there was a profitability for the dentist, so that it's only sold to dentists. So the dentist makes the profit, and not someone like an Amazon or something like that. So how do we integrate Oracare with dental practice? How do they start? I think the first thing we do is have them use it themselves. That's the number one thing. When you use Oracare, it's different. You, it feels like your mouth's different. It's your teeth are smoother because it breaks up biofilm. So I think the number one thing is you'll never sell a product that you don't believe in. So the first the first thing we do is make sure that they believe in oral care. If they believe in oral care, then I think it's a lot easier for them to recommend oral care. I think the biggest outcomes that we see are the perio patients, people that go through SRP and all of a sudden use oral care. The results are just amazing. But the ones that really blow me away are the patients that come in and they have calculus and plaque everywhere. And we clean them up, and then we put them on oral care, and then we bring them back in 3 months. And then all of a sudden, there's not plaque and calculus everywhere. It makes the job of the hygienist so much easier. I mean, there's less plaque, there's less calculus, there's less bleeding. It really is a game changer when we come to everyday care for the hygiene patient. So if you're hesitant to try oral care, I think the biggest thing is do your research. We're the only product out there that has scientific studies that proves that it works, and the before and after pictures. I think that's the biggest thing. I always say, don't trust what I say. Use it yourself. See how it affects you. Give it to your significant other. See how they feel about it. If it all of a sudden it changes your routine, and all of a sudden you're like, wow, my mouth feels so much cleaner. I think that's the biggest thing. Try it on yourself. Try it on your family. How do we talk to teams when they're maybe a little resistant? I think one of the biggest challenges people have is like they don't want to sell products in the dental practice, but I think it's all about your standard of care. At the end of the day, does this product raise your standard of care? I think when I have a resistant team, I think I talk to them about their standard of care. Do you want to be here or do you want to be here? This product raises your standard of care. And I think that's where we should focus, not only on products, but if we want to increase production. You don't want to increase production by adding products or services. You increase production by increasing your standard of care. So sometimes we have teams that, initially integrate oral care, but they don't have great results. And I think what I tell them is take a couple patients and start seeing the results. When you see the results, if a patient is using it twice a day, you're going to see amazing results. And I think once you get results like that, you're going to become passionate about it. I mean, if you're passionate about raising your standard of care, you're going to be passionate about oral care. So oral care cares kind of came about on accident. We invented oral care to replace chlorhexidine. What we didn't know along the way is that it's great for patients going through cancer treatment, from radiation and chemotherapy. Well, oral care helps all that stuff. It helps dry mouth. It helps the fungal infections. It helps all the sores. Didn't know that at the time. But I kept getting these testimonials that said, I couldn't have got through my cancer treatment without oral care. And I'm like, oh my God, this is so surprising. So we got together and go, hey, we got to do something about this. So what we've done is for any of our providers who have a patient that's going through cancer care, we send them a free set of oral care from you and from oral care, and to help them get through this. And we give away about 3,000, 4,000 sets every year, and it's just I don't know. It's something that it's the best part of oral care for us. So I think my advice on taking the next step in your dental career, going from dentist to CEO, it takes one day at a time. Putting down the handpiece is a big step. And I wouldn't do it all at one time. I would try one day. And this putting down the handpiece isn't so you can go golfing more. That extra day is to work on the business. So many dentists work in the business and don't work on the business. We're much more than dentists. We can be CEOs of our practice. And I think Fortune can really help that. Fortune has the environment with like Fortune 50 that we're all CEOs in there, and we can learn from each other. And I think that's where Fortune really can come in and get you to that place that you want to go. So if you're really interested in changing your not only your clinical but maybe your business aspect of your practice, head on over to the Fortune website, fill out a couple forms. Look, I started as a little associate in a little town in West Virginia, and now I have 8 practices. I haven't seen patients in 22 years. I run multiple practices, and all this is because of Fortune. Fortune has been such a big part of that. Um, it's really changed my life, and it can change yours too.